June the 3rd. Coming up in this hour, have you ever wondered about that weird-looking freckle? Now is the time to get it checked. We'll tell you about a free skin cancer screening clinic coming up in Moncton. Well, we're hearing that melanoma, the deadliest form of skin cancer, is on the rise among Canadians, and it's also one of the most preventable forms, according to a new report by the Canadian Cancer Society. And early detection can save your life. Dr. Chiasson is a Moncton dermatologist, and she'll be screening people for skin cancer at a free clinic in Moncton today. We've reached her this morning. Good morning.
Good morning, Jonna.
So what difference can early prevention make if a person has skin cancer?
It makes a big difference in terms of survival rate. So our chance of surviving from that type of skin cancer, and really the early detection is the key in terms of being able to treat that melanoma early and make sure that it doesn't bring any other problems.
So, we've recently heard skin cancer is on the rise in Canada. What are you seeing in your practice?
It's really I've been practicing since '95, and I was under the impression, me and my colleague, that we were seeing and diagnosing more and more skin cancer over the years. But now with the statistic of Statistic Canada, we have a confirmation that it's really not only an impression, but it's also what is happening in reality. So there is really often some people that will come because they have a mole that has changed, and sometimes they are not coming for that, and then as we check their rash or other problems, then they will bring to our attention a mole that has changed recently, and here it is, so it is definitively increasing over the years.
It's interesting that, despite this new information and awareness about the dangers of sun exposure, we heard from people on the program yesterday who, they think a tan is healthy, so they're soaking up the sun, they're going to tanning beds. Why isn't the message getting through?
I know it's surprising with all the publicity, all the marketing, all the activities around the importance of practicing safe sun habits and all that. But it seems that one of the reasons, especially for young women, could be the use of sun tanning beds. And for the population in general, more leisure time, and especially the sun and UV exposure we take before age 30 is very crucial for long-term sun damage, including skin cancer. But really, it's really cumulative all the time. So even later, more like even if we are older than 30 years old, it's still something that will accumulate over time and increase the risk of skin cancer.
So for people who are concerned about, damage to their skin or their possible chances of developing skin cancer, what are the signs they should be looking for?
That's a good question, and it's often something we discuss with our patients, and things that are important to look for. It's a skin lesion that is not healing, something that is evolving or changing, but a good way, especially for melanoma, to kind of remember, it's the A, B, C, D, E criteria. A goes for asymmetry, so pigmentation or a dark or brown mole or lesion that has, if A goes for asymmetry, so if we put an imaginary line in the center of a mole, and we ask ourselves the question, is one side the mirror image compared to the other side? If the answer is no, it's not symmetrical, then there might be a sign that there is something wrong with that mole. B goes for the border, so a border that is heel defined or a border that has irregularities, that might be a sign as well. C goes for the colors, so different colors in one mole, either different shade of brown, some area that are darker or black, gray, or even red. That might be a sign as well. So that's for the C criteria. The D criteria, it's something that is more than 6 millimeter or more, so it's kind of a pencil eraser, then that could be a sign as well. And E go for evolution or changing lesion. So the A, B, C, D, E are little guidelines to help us simplify the criteria of the things we should be looking for, especially when it comes to identifying a potential melanoma.
So if people see any of these signs, everyone knows the wait time to see a dermatologist can be lengthy, and I don't think they want to sit there and wait for a year or two. So are family doctors, trained to detect these signs of cancer? And if they don't have a doctor, what should they do?
Yeah, well, of course, we all have our specialty, and it's hard for all the family doctor to know, the whole thing about the dermatology specialty. But certainly, they have a good training to at least know if something is clearly benign, meaning not dangerous, or know if it falls into what we call a gray zone, or they are not sure. And there's always, in Moncton especially, we are lucky, there's always one of us that are in call that will cover an on-call schedule. So every time that a family physician, either in their general practice or an after-hour clinic or an emergency doctor will see something that is suspicious, they will give us a call, and we'll make sure that we'll see that person in a decent, very quickly, especially if it's a melanoma. We need to address that very quickly, and we will see them very quickly. So there is a coverage in that sense, and
So for this clinic today, do people need to make an appointment?
No, it's a very nice event that is being organized by Madame Courchain from the Executive Director of the Canadian Dermatology Association. It's a free, first come, first serve detection clinic, and I will be there with Madame Courchain, Régent Leblanc as well, to greet everyone that comes in, and between 1 to about 3:30 we'll be seeing a patient as they come in. They will have to register, of course. Then they will see me for a complete skin exam, and then they will receive information on sun protection, all things about being sun smart.
Okay.
So it's a very, very nice activity, especially having that in Moncton. It's really nice.
Yeah, a valuable service, and you've given us a lot of helpful information this morning. Thank you so much.
You're more than welcome.
Bye-bye.
Bye-bye.
That's Dr. Chantal Chiasson. She's a Moncton dermatologist. So once again, that screening clinic will be taking place today from 1 until around 3:30 at the Greater Moncton YMCA.